So my name is Millie Malloy. Millie is my daughter. My disease that I have is actually twofold. It was originally Graves' disease, but it's now flipped over to Hashimoto's disease.
My name is Suzanne Keeney. What else shall I say?
My name is Sutton and I'm her husband.
I was confirmed diagnosis in July of 2012, so I would have been 45.
My disease is called Hashimoto's thyroiditis, and I'm trying to remember exactly when it was diagnosed. I think it was about 30 years ago.
I had unusual anxiety, which was not something that I normally experienced. I had a racing heart at times, which didn't make sense. I was unusually hot, and I was losing weight very rapidly. At the absolute diagnosis, I would have heart palpitations, and my heart would race, and that was scary. It felt like I was about to have a heart attack or something really bad was going to happen. I was relieved that there was a reason for the way I was feeling. I now take actually, I take a natural T3, which is like levothyroxine, except it's made from desiccated pig thyroid.
Medication is called nature thyroid, which is an organic form of thyroid. And then I take vitamins and things like that. It's recommended by my endocrinologist.
Diagnosed, it was every 3 weeks, and then as I stabilized, it went every 3 months, and as I stabilized more and more, it's every 6 months to a year.
Oh, I think about 4 times a year.
This has been a true bummer. I never had to worry about food in my entire life. I never had to worry about my weight. I never had to worry about what I eat, and now I have to constantly think about it because my metabolism has been slowed down so much that it has become something that I have to think about, and I have to exercise. Is not for fun. Exercise is for, maintaining weight now.
The thyroid condition has been present for us for a very long time, and from my point of view, it's very stable. So it isn't like something that comes and goes and you have to adjust all the time. It's just a presence, a stable presence. And I can't say that it makes any difference because it's been this way for some time. It doesn't have much of an impact on us, on me, day to day.
It's a very difficult disease because it makes you tired sometimes, really tired, and it's not always even. Sometimes you feel well and sometimes you don't. It also causes you to gain weight, very difficult to lose weight. So for me, the changes have been that I've had to adjust to not having the energy I had, and somehow try to accept the down times more than I had in the past.
Absolutely, there's a very strong hereditary component. In fact, my mom has Hashimoto's and my grandmother had Hashimoto's. So the chances of one of my kids having it is pretty high.
Well, my daughter has a Graves' disease, which is in remission, and I know that's a form of thyroid disease. I don't know if mine is an autoimmune. I guess hers is too. Mm-hmm. So I think that it might run in families.
I've never attended any support groups, but I have spoken to Suzanne about it a good deal, and I've Googled it, of course, and done a fair amount of reading. And I've also known other people who had related conditions, including other family members. So it's been, to be fair, superficial, but significant, I think.
My name is Dr. Greg Bombassei, and I'm an endocrinologist. That means that I specialize in the treatment of disorders affecting hormone-producing glands. Graves' disease is autoimmune thyroid disease, and what that means is that the immune system is the source of the problem. Now, you're supposed to have an intact immune system. Your immune system is what makes antibodies, the proteins that enable you to fight bacterial and viral infections. The problem occurs when the immune system is a little too vigilant and starts attacking some of the body's own cells. And for reasons we don't understand, the thyroid is a frequent target of these errant antibodies. In the specific case of Graves' disease, these antibodies bind to and stimulate the thyroid cells to grow, to divide and multiply, and to make too much thyroid hormone, so that the affected person has what's called hyperthyroidism. They make too much thyroid hormone. And that speeds their metabolism, which sounds like it would be great, but it's not, because they lose weight despite eating a lot. Their muscles become weak and atrophy. They experience reduced exercise tolerance. Their heart beats fast. They break out in a sweat. They have diarrhea. They really, really don't feel well. The tests I do to confirm my diagnosis can be, I get a lot just from the history and the physical exam. In fact, most of the time you can make the diagnosis just based on that. To confirm it, blood tests are helpful, sometimes radiology tests also, and sometimes I have to do biopsies to make a diagnosis. The treatments for hyperthyroidism are three, and the trick is picking the right treatment for the right person. Thyroid surgery is definitive, cures the condition, but I reserve it because of the risks of surgery. I reserve it for people who have very, very large thyroid glands, or people in whom I suspect they might also have thyroid cancer at the same time. Those people get surgery. Radioactive iodine is probably the most used treatment in this country because it's definitive, that is, it cures the condition, it's convenient to give. One dose, one pill, one time only, and 85% of people are cured. And that sounds great. Why doesn't everybody get that? Because it leaves you with a permanently underactive thyroid gland, which is another problem. What I like to do when I can is to use anti-thyroid medicine. That is, treatment to reduce how much thyroid hormone the thyroid gland makes in response to those antibodies, in the hope that it will one day go away just as insidiously as it came on. And in about, close to half of patients with Graves' disease, they will get better themselves in time, but it might take a lot of time. A year and a half is not uncommon. 18 years is my record.